Hello and welcome to Seven Sentinels. This is Grandmaster class and I'm Peter Simon with you. Today we are conducting speaking sessions and here we have with us Kiran Kaur from Delhi, India. Yes, Kiran, once you are ready, you can start. Hello, Kiran. You can unmute. Connect your audio. Hello, Kiran, connect your audio. Connect your audio. Remove that. Go out and come again. Yeah. Can you hear me now?
Yeah, sir. I can hear you.
Yeah, you have to concentrate on these things. Okay.
Sorry, sir.
No problem, no problem. Yeah. It's okay. Mistakes happen, no problem. Fine. Hello and welcome to Seven Sentinels. This is Grandmaster class and I'm Peter Simon with you. Today we are conducting speaking sessions and here we have with us Kiran Kaur from Delhi, India. Kiran, once you're ready, you can start.
Okay, sir. I am ready. So,
Yes.
how can I address
You can call me
you during the
Lincoln.
conversation?
Yeah, you can call me Mr. Lincoln because my name is Abraham Lincoln.
Yeah, okay. Abraham Lincoln. And good evening, Abraham.
Good evening,
My name is
nurse.
Kiran. My name is Kiran. I am one of registered nurse working in this clinic. And so today you are here because you have an appointment for further education regarding your self-insulin administration. Is it right?
Yes, nurse, I'm very much anxious and I'm unsure about starting insulin injections. I have been managing my diabetes well until now.
Yeah, okay.
But why did the doctor ask me to take these insulin injections in the first place?
Yeah, actually, your concern is absolutely understandable. And let me tell you that it is important because you have previously managed your diet according to but till that you have your blood sugar level is very high and the insulin injection remain last option for you to need for take. So you need to take this to manage your sugar level. So are you able to follow me?
Yes, of course, nurse.
Okay. So I rest assure you that there is a quite common procedure in all the world, and please remain and calm. please remain and calm. It is because this procedure is very successful rate in over the world, and and there is no cause of the pain because this injection only given in the superficial deep muscles, not given the deep muscles. So there is no possibility to cause any type of pain. And in this procedure, we also use a tiny needle, so there is no chances to any cause of hurt. So are you comfortable now?
Yeah, of course, nurse. I
Yeah.
am able to understand what you're saying, but
Okay.
is there no other way possible to manage my diabetes? Is this the only way?
Yeah, there actually till date you have successfully managed your diabetic with your medication regimens, diabetic diet, and regular physical activities. But that is not going to help you and anymore because your condition is deteriorated, and therefore accepting the situation as it is and moving ahead with the suggestive changes would be profoundly beneficial. So uh, are you getting my point?
Yeah, of course, nurse. I'm able to understand what you're telling, and I want to know
Okay.
if there is any information which I need to know. Can you explain me?
Yeah, initially, as your expert concern is reasonable undoubtedly, and initially I will demonstrate the steps of procedure. First, once you have confidence, so you once you have confidence in this, you feel very easy. This is procedure. I know that it is sound very difficult at first, but with the practice, I am sure you will be able to administer effectively. You know, Mr. Lingan, injection is better than tablets because it have the property of easy, earlier, and easy absorption. It is not effective or broke down the integrity of the skin, and there is very effective. This is very effectively work in our body to maintain the high blood glucose level to come in the normal level or manage in the normal level. So it is important to you to uh, for follow up your self administered injections. Now, one more thing, there is, I will, one more thing, if you have permit, if you permit me, I will be, explain the procedure for the self-administrating injection.
Yes, nurse. Of course. Please explain me everything. I want to know because I don't want any side effects or any
Okay,
problems.
yeah. The side effects, it's negligible, but let me explain you first. There is a total 5 sites where you can take the insulin, the right and the left shoulder, the right and left the thighs, and around the finally area around the belly button. And if you are going, if we are going now educate the steps of regarding the self administration of insulin. It is extremely important that you rotate your site injection because taking the injection repeatedly on the same side will result in the lump formation and bluish and lack of absorption of insulin. Make sure you rotate your site for prevention of further complication. Now, first of all, draw the extra amount of quantity as prescribed by your doctor and wash your hand properly and dry it effectively. Choose the side where you comfortable, and pinch the skin. Insert the needle at 45 to 90-degree angle. Push the all selective amount of medicine in your selected site and leave it at least 5 to 10 seconds. It is done. It is very easy process as I told you. So are you want more clarification or explanation for regarding procedure?
Yes, of course, nurse. That's all the information is very clear. And what should I do with these used needles? Am I supposed to just throw them, or
Yeah, okay.
what am I supposed to do?
Yeah, this your appropriate concern is your concern is appropriately. Now, in your safety measures, look at this container. This is meant for disposing all the sharp instruments, oh sorry, all the sharps as well as broken glass vials in order to prevent accidental injuries. And please remember, if please remember once this container is full, 3 to 4, you can call us and get the replacement. And secondly, the storage of insulin according to recommended temperature is of uppermost priority. So that now that everything is important aspects are discussed in this detail, shall we move on to demonstration?
Yes, nurse, of course. That's fine.
Okay.
I want you to tell me. Oh, okay, right. Oh, is there anything else that I need to know? Are there any side effects or ongoing problems because of this one?
Yeah, so the injection side effects is rarely, but there is minor pain, little bit pain when we administrating the injection, and there is no any other complication or side effect except the minor pain only. And make sure if you're rotating your side, there is also beneficial to you because the prevention of lumps and the effectively work for proper absorption of all the administrating insulin is yeah, make sure you rotating your sides. So now you can as I can rest assure you that you can self injected insulin under my observation. We can continue in this way for the some days till you are confident. So are you comfortable now?
Yes, nurse.
Okay. I strongly believe that I hope providing all the information, all necessary information to you. But if you still having any question, any queries, do not hesitate to contact to ask me. So thank you so much.
Yeah, thank you very much, nurse. That's really wonderful. Thank you once again,
Okay.
and I appreciate your care and concern. Thank you.
Okay. Thank you so much. If but still you have any question, please ask me.
Yeah, now let's go on with the feedback session.
Yes.
Now, there are a number of pauses and breaks. It's okay. It's okay. You're beginning, so you're beginning to work hard, and this is online. And so maybe you're have the fear of online classes. Suddenly you come on the YouTube or Zoom or video, everything. Maybe you have some, phobia of this one, but you'll overcome that. This is to increase your confidence level. So next one, you said the side effects is negligible. The side effects are negligible, not
Okay,
is,
sir.
are negligible. Side effects is plural, so you have to use are negligible. The next one you said administrating. It's not administrating, it is administering. Administering.
Administrator.
Yeah.
Okay.
Then you said rotating, if you rotating, if you are rotating, or if you rotate. If you rotate,
Okay.
that will be better. If you rotate, then you can self-injected. You can self-injected. You can self-inject insulin, not self-injected insulin. You can self-inject insulin, no ED. So these are some
Okay,
mistakes
sir.
which I have noticed, 5 mistakes. And apart from that, there is a shivering in your words when you're speaking. And I think you might have made some notes, and maybe you are reading from the notes also often sometimes, because suddenly you forgot, or you're scared, and because of that fear you thought maybe you will be doing mistakes. So maybe here and there you started, maybe I think 4 or 5 times you started reading the paper. Am I correct?
Yes, sir.
Yeah, because I can understand the way how you are reading, that you are reading from the paper. So what you have to do is, if you do mistakes also, it's okay. Make it a habit that you do not read from the paper. So you can only make bullet points. You make notes, study all, practice all. But when you come to me, take the empty bullet points, some points, not the sentences. And you can just,
Okay,
based
sir.
on the bullet points, you can practice. If you do mistakes, it's okay. If you do mistakes, it's okay. But that's always better. So you'll get an idea. Today you'll do 2 sentences, tomorrow 3 sentences, day after tomorrow 4, like that. Gradually it will grow, no problem. How much ever you speak, that's not going to problem, but reading is not going to help you in any way. So generate some ideas. With your confidence, you can speak 3, 4 sentences also, okay, for each question. Right. Then next one, confidence level you have to improve, and yeah, fluency, even your speaking fluency level. Every 2 words or 3 words, 2 words or 3 words, you're cutting, breaking the sentence into bits and pieces. So the fluency is lost. Yeah, grammar mistakes I have already told you. Quality, I can say it's okay. I cannot say you better or best. Confidence level is little lower. It's not like that. In the warm-up session, you have done really well, but here you failed to keep up the standards. No problem. And practice more. You are doing well. Why? You already told. When you are writing very nicely. Okay. When
Yes, sir.
you are writing very nicely. But when speaking, the difficulty arises. It's very difficult for you to speak on the spot. So no problem. What you have to do is take the phone and learn one sentence. Now, what you do is take your phone. Then you can take your WhatsApp. And then what you can do is you can just open my WhatsApp there. Then once you open my WhatsApp, then you can just see there, and you can take the audio. Yeah. Your health and welfare is our fundamental priority. Your health and welfare is our fundamental priority. Your health and welfare is our fundamental priority. One sentence, 3 times you can speak, and you can just send me like that. Again, insulin injections are the only possible options for you. According to your present condition, there is no other possible option for you but insulin injections. Insulin injections, self-injecting insulin is the only possible solution in your present condition. So like the 2 or 3 different variants you can speak. This is one
Okay, sir.
option. If you are compliant with insulin injections on a daily basis, your condition will become stabilized. Okay. And it can be further deterioration of your condition may be prevented. Like this. You can take the sentences and you can just send me like that on your WhatsApp. That is the best possible
Okay,
option for you, because you don't have the habit of speaking. You don't have the habit of speaking. That's the
yes, sir.
biggest problem, because only when you are coming to me, you are speaking. That's okay. Now, from now onwards, you need not do any speaking with anybody. You'll be doing only one speaking with me, because if you practice with others, you'll get only that practice, but that confidence level you will not get. Just you will practice
Yes,
as
sir.
if you're talking to a friend. When you're practicing with me, you understand the real situation. Correct?
Yes, sir.
So that is what I tell you. So now this is what is the feedback for you. And yeah, focus on practicing more sessions. Overall, I can say it is good. It's the first session for you online with me, and you're going to improve on a gradual basis from tomorrow onwards. See that you'll practice. Now I'll give you the next card. Prepare well. Take more time to prepare too, because tomorrow you're not going for the exam. You're going for the exam sometime later. So prepare first, and prepare. Take more time. Write all the sentences and practice the sentences. One sentence you speak 10 times. Then second sentence you speak 10 times, so that your fluency, your word processing, and your sentence formation can be getting shape, proper shape.
Okay,
And you
sir.
can get
Okay, sir.
used. You can get used your tongue, your throat, your mouth, your lips, and all these things will get attuned to your speaking. so that they'll get adapted to your style. And when you speak with me, automatically your words will come like that. At least if you practice 10 sentences, you'll get 2 sentences first day, next day 3 sentences, next day 4 sentences. And once you practice like this for 15 to 20 days, automatically your words will come even without any practice. Just like that, they will flow from your mouth. That is what I can tell you. So that's fine, no problem. You have done a good job. First of all, you have stood there, you have sat in you sat in your place for almost 5 to 7 minutes. That's okay. That's itself is your strength. Okay, whether you're doing perfectly, or whether you're reading, or whether you're speaking, or stammering, or stuttering, or whatever it is, you stood there till the end. Finally, you completed in whatever way possible you could. So that's more than enough. From tomorrow onwards, little by little, the progress will be there. Is that clear?
Okay, sir.
Now I'm giving you 1 minute. You have 1 minute to speak whatever you want. How your this class helped you, how you are getting confidence. Okay, it's difficult for you, but you're practicing, and how well the feedback is given, and how excellently you're practicing. All these things, and how the sessions are helping you. All this you can speak in 1 minute. The time starts now.
First of all, thank you so much, sir, for discussing everything about my lacking and how my studying and humpering during the role play. And secondly, it is good idea when I go in WhatsApp and speak, recording my voice and send to you. I thought it's very helpful and very good idea for improving my speaking uh, and for improving my speaking as well as my practice also. And definitely, sir, I will be pass OAT in the first attempt. It's my ambition. I am pass in the first attempt. Thank you so much, sir.
Yes, that's good. So students who are watching this video on the YouTube or Facebook or Instagram or any Telegram or anywhere else, so you can just watch the videos, all the videos, and you can take at the end of the video, there will be my suggestions. Okay, what I gave for the students, how to speak, what are the tips, tricks, and techniques and strategies that can be adapted. Those are more important than the other part of the video. So you can learn from others. See, many students have given many sentences, and you can learn from them. You can note down those points, and you can improvise in those areas. And altogether, at the end, I'm giving you feedback of what are lacking, what should be improved, what areas should be focused, and how can you practice in that particular part and enhance your skills, speaking skills. That is the most important point. And the vulnerable areas can be improved definitely on a gradual basis. See, for example, this girl was facing some fear. She had some fear talking, and then suddenly she forgot and she started reading. But definitely that's okay. But still, the good quality in her is she did not stop the video and say, "Sir, I cannot." She still, till the end, she did it. That's the strength. That's the spirit. Okay, we did less, no problem. So definitely in the long run, we can improve. So after doing for 20 days, you'll definitely improve. So that's what I tell you. And if anybody is interested in taking subscriptions, you can contact me on 91 plus 91 98 778 67360. That is Grandmaster class. See you again in the next session.
Okay, thank you, sir.